Alright, hello and welcome to our professional interview group presentation. Our presenters today will be Cody Adair, Kassidy Oldenkamp, Samantha Oldfather, and Sophia Stahl. We will be discussing our interview with Kenna, who is a licensed social worker and who is close to becoming a licensed clinical social worker. The first question that was asked is, what are the licensing requirements to become an LCSW in the state of Colorado? The first requirement is the completion of a Master's of Social Work. Then you have to pass the jurisprudence exam and a licensing test. After both of those are completed, 2 years of supervised clinical hours must be completed before you can become an LCSW. There is a broad definition of face-to-face clinical hours, which opens up a lot of opportunities for these hours to get done. Kenna mostly works with individuals and families as she gets her hours completed. LCSWs must be supervised by qualified LCSWs in order for their hours to count. Kenna's typical clients include teens and kids, but also some adults. She does outpatient care and sees clients from primary care, mental health hospitals, school referrals, and also self-referrals. What will you have to do in order to maintain your license throughout your career? An LCSW has to renew their license every 2 years. This includes completing continuing education credit hours. These hours can include classes, various trainings, reading books, and other education hours. For education requirements, the question was asked, what are the educational requirements, courses, semester hours, practicum hours at the master's level to become a licensed clinical social worker? Because social work is such a broad field, one person's MSW can be very different from another. In Kenna's program, there were 2 tracks, a clinical and a policy track. She did the clinical track with a focus on family systems. The first year had a variety of courses in policy and clinical work to expose students to both of the tracks of the MSW. The first year internship was 16 hours per week, and she worked in a medical setting. The second year had concentrated track classes. These included family systems, trauma, and existential social work. The second year internship was 20 to 24 hours per week, and Kenna had her own caseload and saw clients. When asked about doctoral programs in this field, she said that she would get a doctorate in social work, and they tend to be more research-based instead of clinically based.
Hi, this is Samantha, and I will be presenting on the professional history and development into the field of Kenna's experience. So, where did you choose to get your degree from, and why that program? She chose DU to get her degree. She personally loved the campus, and she had a positive experience talking to people who previously went to DU. With these things combining with her intuition and her calling, and a little bit of her prayer life, she decided that DU was an excellent program for her. And then she also wanted to have a different type of perspective outside of CCU when approaching her future career. The second question is the professional history and development into the field was, how has your education played out into the development of you as a therapist? She gave us some wonderful insight in which she said that during her undergrad, she discovered herself as a Christian and a therapist. This is really the foundation of what led her into her master's, where she took more of a systems perspective, which seems to be very helpful. Within the mental health system, Medicaid, family, culture, and ethnicity, there are many different levels that impact the person and the client coming in. She said that being aware of what happens within the systems can help understand the individual and help them the best. She's also often thinking of things in the context of families, which is really cool to see how both her education and her experience is able to play in and out of the office. The last question of professional history and development into the field was, coming into this field, what is one thing you wish you would have already known, / what is one piece of advice professional you would tell student you? she came back with a response. I wish I could tell student me that the work you do on yourself outside of your office is incredibly important. Be vulnerable, don't have all the answers, and the best moments are when she doesn't have the answers. This is really humbling to hear because as a future therapist and as my group approaches this field, it is important to understand that not all the answers will just come to us. And so to hear a counselor say that is very beneficial. The second answer that she gave us was that supervision is so important. Find the right supervisor. Don't take an internship if you don't connect well with the supervisor. This is really important because this helps in graduate school. This helps guide where you're going to get a job, what kind of people you're going to be reaching out to, and your fellow coworkers. And so Kenna was able to give us a little bit of her experience, both in her undergrad and her master's, as well as give us advice for us as we pursue this career.
All right, this is Cody Adair, and I am going over the professional organizations membership and ethics portion of the interview. And the first question that was asked of her is, what is the importance of being a part of professional counseling / social working organizations? So in other words, what support does it provide? And she answered that on a weekly basis, it looks like both individual supervision and monthly group supervision. And she also goes to a weekly consult group where she's able to talk about her cases and get her perspectives on the cases. And she said this was especially helpful for her when she wasn't quite sure how to go about a case, or just even getting recommendations on how to handle something better, because it's a lot more of like a peer level type thing. And she also does monthly trainings at the practice that she's currently in, and I'll get into that a little bit later. But something that really struck me was her saying, "Can anything prepare you for this?" And what she was saying by that is she had spent all these years training, and she's moving towards getting her license in social working and is very close, but she felt even as she was working that she was like struck by like this question of how like I wasn't prepared for this. And so she said that peers are really encouraging as well, whether they're in her organization or whether she happens to meet them. And on a personal note, friends and family who are very empathetic to that is helpful to her as well. Next question is, what organizations, social work, or counseling are you involved in? And the first one she mentioned was the Colorado Society of Clinical Social Work. And obviously this is for social workers, both clinical and without that clinical aspect of it, but they basically just teach a series on different topics, whether that's sex therapy, parent-child interactions, attachment, ethics, etc. And she was saying that it all feels like a lot, but they're super helpful. And so, it's all optional, of course, but she goes to pretty much everything she's able to because she wants the support and she feels like it makes her a better social worker. And of course, again, getting that other perspective, she's saying that oftentimes she feels like she's an echo chamber, just echoing things inside her mind all the time. And so it's helpful to kind of externalize that and get some outside perspective. Next question is, how does being a member of these help guide your ethical practice as an LSW? And so she said individual supervision was most helpful for this, specifically someone who knows you as both a person and a therapist, because then they're able to combine that knowledge and kind of help you apply that both to your day-to-day life, because again, this profession in any sense, social working and counseling, definitely involves a lot of that lifestyle aspect. So she said that other places are good for hearing others' perspectives, but they don't allow you to go to that level of detail about like your ethics or issues in counseling. So again, that individual supervision is a lot more of what's helpful to her. So that's all I have for this portion of my presentation. So Sophia will be taking it away next.
My name is Sophia Stahl, and I'm going to share with you what my experience was like interviewing Kenna Brochler, and just kind of what I learned, what her role is in the funnel of social work. So Kenna's personality is bubbly, bright, she's so kind, she's very empathetic, and she's passionate about the type of work she does. I think this makes her an excellent social worker. the amount of time that she spent learning how to empathize with people and see people within a social context. She's clearly meant for this role. Kenna has worked at a company called LifeStance for 6 months now. This company is located all throughout the United States, and there's just a branch of LifeStance in the Denver Tech Center in Denver, Colorado. She is a few months away from getting her LCSW licensure and has been working towards this for over a year now, and she is thrilled to have that opportunity. Kenna loves her current clients. In her past work environment, she was going into different houses and working with young children, and she really emphasized how she loves working with teenagers now, who are just a little bit more mature and who are able to understand more complex concepts. She said she also loves working in her own office space, and that's because when children are in their own environment, they can become almost too comfortable, and they're not fully honest with her all the time when their parents are in the same room or in the same house. So she really likes creating her own environment for teenagers to come in and open up a little bit more about who they are outside of their household. Kenna also loves her colleagues, and she loves her unique systems perspective that comes with a social work background. Kenna explained to me that one of her biggest takeaways from grad school was a perspective of a human being in their social, their demographic, and their family context. She said a lot of therapists she thinks can be limited by the perspective of just the individual rather than the individual in a large network of social contexts. Just to speak briefly on what continuing care looks like in social work. So in social work, intake consists of a brief assessment identifying immediate needs, an individual's demographics, and basic needs such as food and shelter, as well as substance use. So in social work, it differs a little bit from what an LPC might be doing in intake because a social worker is looking for immediate threats to an individual's safety. So many individuals will come into social work, a social worker's office, maybe abusing drugs or maybe without a home and needing immediate support. So Kenna explained to me that it's important that in intake, an individual feels safe enough that they can express those needs and that Kenna has a chance to address those immediately. Outpatient care allows social workers to work with clients who are outside of hospitals, schools, or prisons. Kenna primarily works with outpatients, and she enjoys the opportunity working with patients outside of the context of a hospital. Aftercare services in social work can include fulfilling accommodation needs, strategies for mental health support, and close monitoring of youth as well as disabled individuals. Aftercare is very important in social work because sometimes clients aren't going back to safe spaces. They don't necessarily have a home to go back to. So a big part of social work is creating new spaces for people to feel safe and giving support that could look like additional counseling or just additional monitoring of people who don't have that type of support outside of this context. Kenna's role within continuous care in social work. Kenna works in outpatient treatment primarily. Her clients are often referred to by a primary care physician. They come from mental health hospitals or they're referred by a teacher or a school counselor, and the adults that Kenna see are often self-referrals. Kenna finds it important to gain context of any prior treatment a client has received or any medication they're taking currently or any other therapist they might be seeing. She said this is very important because it kind of points her in the right direction for treating her clients. LifeStance houses LPCs, LCSWs, LPs, and adult child psychiatrists. If Kenna is unable to treat a certain client, she has the opportunity to pass that client along to a colleague. She often works closely with psychiatrists on the team when a teenager needs both counseling as well as medicinal support.
Moving towards conclusion to wrap this up, most of us in this group are either working towards our LPCs eventually or LMFTs. So a little bit different from social work, but nonetheless, there are some principles that we can learn from this. And the first of that being the school you choose matters. Whether that's continuing in Christian education for master's or doctorate if you choose so, or whether that's a secular education, kind of really stress the idea of discovering yourself as both a Christian and a therapist and understanding the ins and outs of how that works for your daily life. Having an okay placement for internships with a great supervisor is critical. And what she means by that is, if the internship is kind of meh, right, but your supervisor is awesome, that will help develop you no matter what kind of internship you have. So having that great relationship with the supervisor is very critical, as well as having support from your supervisors and other clinical workers, because, this work definitely can be draining, and you will see some of the worst of what humanity has to offer. And so you need that support from other people to help you process through that, help you with cases, etc., like we discussed. And finally, just finding the area that you're passionate about. If you find somewhere that you really enjoy working with, a people group you really like working with, that will just make you a better therapist in general or social worker. So thank you for viewing our presentation, and that is all we've got.